Look, there are two things we definitely need to discuss: where blood pressure comes from and what is considered normal blood pressure. Where does blood pressure come from? Look, we have a vascular system. That is a system made up of tube-like vessels, which is filled inside with a fluid called blood. So the vascular system is filled with fluid, and this fluid is blood, and it is under a certain pressure. But the pressure inside the vascular system, the vascular pressure, can be either arterial or venous. But vascular pressure is determined by the tone of the muscular wall of the vessels themselves. So in these three tube-like vessels, we have an inner endothelial lining, which is smooth so that the blood can glide, and an outer layer that nourishes the vessel wall itself. And between the inner and outer layers is the muscular wall, made up of smooth muscle fibers. These smooth muscle fibers can contract, causing the vascular system to constrict, the volume of the vascular system to decrease, and as a result, the pressure of the fluid, blood, inside the vascular system increases. Or, on the contrary, the muscular wall can relax, the smooth muscles can be relaxed, and then the vascular system, as it were, has an increased volume. And because the volume of the vascular system is increased, the blood pressure inside the vessels decreases. So guys, understand that the pressure inside the vessels is determined by the condition of the muscular layer of the vessels themselves. And it is more or less the same throughout the body, because the factors that affect the muscular layer of the vessels, if they do have an effect, will influence, let's say, the whole body. And that's why the muscular layer, specifically the condition of these muscles, the smooth muscles, determines the state of blood pressure, arterial pressure. It can be high or it can be low. This is an important factor. And now another important factor. What pressure is considered normal? Look, how do we measure blood pressure? We don't do it based on how we feel, right? How do we measure blood pressure? By the Korotkov method. We put the cuff on the arm, inflate it with air to compress the vessel, and listen at the elbow crease. And so when we've fully inflated it to compress the artery, we start releasing the air and wait for the first moment when the blood manages to pass through under the cuff, and we begin to hear the beats. This is called the upper or systolic pressure. And as it keeps beating, the blood continues to pass through, breaking through the brachial artery compressed by the cuff. When it stops forcing its way through and starts flowing normally, we stop hearing the beats. The moment we stop hearing the beats, that's the lower or diastolic blood pressure. That's the old-fashioned way, you could say, the way we used to measure it. Nowadays, electronic devices do this, but in the old-fashioned way, the upper pressure is systolic and the lower is diastolic. And we need to know the normal ranges. These norms, I'm emphasizing this, are important. So normal blood pressure for a person is an upper value from 100 to 140. That's the norm. So an upper pressure of 100 is normal, and an upper pressure of 140 is also normal. The lower or diastolic pressure is considered normal from 60 to 90. So both 60 and 90 are normal. Both of these pressures are considered normal for a person. And if your blood pressure falls within these ranges, 60 to 90 for the lower value, 100 to 140 for the upper value, then, medically speaking, your blood pressure is considered normal regardless of how you feel. So, what is low blood pressure then? Well, let's take a look at that now. Low blood pressure for a person is considered to be arterial pressure when the upper value is below 100 and the lower value is below 60. For example, 90 over 50 would already be low, below normal blood pressure. This would be hypotension. And if your blood pressure is below 100, below 60, then this is considered hypotension. But as a doctor, I don't really encounter hypotension. I encounter real vegetative vascular dystonia. What is that? It means feeling unwell, being in a poor state, dizziness, weakness, nausea, fatigue, sluggishness, lack of strength, lack of energy. Vegetative vascular dystonia is when a person feels unwell. even though their blood pressure is technically within the normal range. That is, a person might have blood pressure of 105, 110 over 70, and yet they already feel unwell, but that's normal. But the person already feels unwell. So what is vascular dystonia? It means that the arterial pressure does not correspond to changes in the environment, changes in atmospheric pressure, humidity, weather changes, solar storms, and so on, some kind of magnetic dissonance in nature. So vegetative vascular dystonia is a mismatch. To put it very simply, it's a mismatch between my blood pressure and the atmospheric pressure. That's what it is even. And when this mismatch occurs, that's when I feel unwell. It's not necessarily low blood pressure. It's not necessarily hypotension. A person can feel unwell even with normal tension, with normal blood pressure. And basically, you see, it's simply the poor functioning of the body's adaptation system. The human adaptation system is the autonomic nervous system, which adjusts my body's functioning to the changing parameters of the environment. First and foremost, this includes atmospheric pressure, humidity, and various weather changes. And because of this, our autonomic system is supposed to adjust the body's functioning to these changing parameters. But sometimes it doesn't. The pressure is incorrect. There's a mismatch in pressure. And when our pressure doesn't match up, then when the weather changes, we end up feeling unwell. This condition is what is called vegetative vascular dystonia. But this is not hypertension. True hypotension is low arterial blood pressure. Low in terms of the actual numbers. That means the upper value is below 100, or even the lower value is below 60. So how does it manifest itself? Well, let's now take a closer look at how hypotension, real hypotension, actually presents itself, and what in general will happen if there is low blood pressure. It turns out that the heart pumps blood weakly, the pressure in the vascular system is low, and as a result, the pressure doesn't reach those distant areas where the vascular supply, that is, the blood, is supposed to go. As a result, blood doesn't reach the fingertips, so your hands will feel cold, although they get cold for another reason too, which is a lack of heat supply, but still, your hands and feet feel cold. And here's the most interesting part. The blood doesn't reach the highest point, the head. A person starts yawning, experiences salt weakness, low brain productivity, quick fatigue, feeling unwell, and later on, nausea, dizziness, and general weakness. Why is that? Because the blood doesn't reach here, and this is a sign of poor blood supply. There will also be poor blood supply to the digestive system, poor digestion, and as a result, the whole body receives insufficient blood. Well, it's just not enough. Weakness. The main point here is weakness. The main indicator is this low arterial, low vascular pressure. And in this state, a person is kind of weakened. And in this condition, their work capacity is low and their productivity is low. This low blood pressure is what bothers people. But in fact, the relaxed state of the vascular walls requires toning. It needs some kind of intervention. What kind? That's the question now. How do you solve the problem of low blood pressure? High blood pressure is always dealt with. We have pills for that. Are there pills for low blood pressure? That's interesting, isn't it? Well then, let's figure it out. All right, guys, let's get started. If we have low blood pressure, that is weak tension in the muscular walls of the blood vessels, we need factors that will affect these muscular walls, and these are influenced by neurohumoral factors. Neurohumoral. Neuro refers to the influence of the autonomic nervous system, specifically its sympathetic and parasympathetic branches. But what we need is the sympathetic branch. Humoral means influence through fluids, through the blood. This could involve hormones, various hormonal effects, factors, and medications. By the way, there are also medications that affect this. Look, here's the simplest example. You have low blood pressure. That's a humoral effect on the vascular wall. You drink a cup of cheers. Coffee. You drink a cup of coffee? Wait. What is coffee anyway? It's an extract from beans, coffee beans, and they contain caffeine. Caffeine is basically like adrenaline. Caffeine is a factor that causes spasm, a narrowing of the vascular wall. The vessels essentially narrow. Their muscular wall does not narrow, and then the pressure rises. This is a basic, simple example of what everyone does, coffee. But the question is, are we really drinking coffee, or is it not actually coffee, not real coffee? I think I'll make a separate video about coffee, what it really is. You remember the commercial, right? We pick the very best beans and the rest we send to you. Well, I'm sure that what you have isn't the real coffee, not the genuine coffee grown where it's supposed to be grown. It's still a little bit different. But this is the simplest example of a humoral solution. Maybe something like, well, to take it medicinally, like sodium benzoate caffeine, but I think that's unnecessary. There's no need to do that. Maybe it's some kind of chicory drinks or others like Shisandra or other beverages that cause a mild stimulation, toning effect, various tonic drinks. Next, the neural system. So, look, I need my sympathetic nervous system to be activated and for adrenaline to be released in my adrenal glands. If you have low blood pressure, try doing some squats. Do 30 squats. Because of this physical, get off the ground. Well, on the pull-up bar, do some physical activity, go for a walk or a run. This physical activity activates the sympathetic nervous system, the adrenal glands kick in, adrenaline is released, the blood vessels constrict, sympathetic impulses also constrict the vessels, blood pressure rises, and the body is energized. But this is a one-time effect. If you want to fight low blood pressure on a regular basis, you need to do this systematically, just consistently, just regularly. Low blood pressure is a condition typical of people who are sedentary and do not lead an active lifestyle. In addition, there's something else I mentioned in my previous videos. How do you properly activate the adrenal glands? The adrenal glands are activated at 6 in the morning. At 6 in the morning, remember that. If you're sleeping at that time, you've missed the window for adrenal activation. That's it. Forget about your health. You need to wake up at 5:30 so that by 6 in the morning, you're already out for an energetic jog around the block. Waking up early in the morning. In other words, night owls are always sluggish with low vitality. For early birds, it's always high. That's why you need to make sure you wake up early. This is one of the factors for maintaining normal blood pressure. Next, don't try to charge yourself up with coffee in the morning. Try to energize yourself with a jog, some exercise, or working out on the parallel bars or pull-up bar. Listen, it's such a pleasure for me when I go outside at 6 in the morning and see young people near the sports ground. 6 in the morning, the sun hasn't even risen yet. 6 in the morning, and they're already working out on, what's it called, the parallel bars. The parallel bars, not the pull-up bar, but it's amazing. I really like that. They're getting their bodies going from the very morning. And even though it's already kind of chilly outside and they're not really dressed, well, let's say appropriately, not warmly, but for some reason they're not cold. For some reason they even get out of breath. They just feel so good on those parallel bars. Why is that? Because this physical activity has energized their bodies so much that they're not cold. They have energy to spare. If you have low blood pressure, you need to activate your body. The main way to energize your body is through physical exercise. Everyone is probably expecting Dr. Golod to start talking about the Turmanium mat now. I'm not going to talk about the Turmanium mat. It's not about that. If you need to deal with high blood pressure, warm yourself up. Heating causes your blood vessels to dilate, but heating causes the vessels to expand, not constrict. To make them constrict, you need to engage in physical activity. Be active. If you work at the computer, follow the 50-10 rule. Remember this. I work at the computer for 50 minutes, then for 10 minutes I need to get up, walk around, do some squats, do some push-ups, get some physical activity. Want another idea? It's a really good one. I live in a 9-story building. Try this, it's a great trick. Go from the first floor to the 9th and back down twice. That's it. Excellent. And your blood pressure, perfect. You get physical activity, your lungs expand, your heart is working, and your eyes, well, they're in good shape. You see? So physical activity, that's exactly what you need to solve the problem of hypotension. People ask me, what should you do to solve the problem of hypertension? Drink water, warm your feet, warm your kidneys, keep yourself warm. That will solve the problem of hypertension. But for hypotension, it won't. For hypotension, it's physical activity first and foremost. It's about your lifestyle first and foremost. And then you'll have a healthy condition of your vascular walls and your blood pressure. And the same approach works for treating vegetative vascular dystonia, the same kind of routine. Vegetative vascular dystonia is actually your body adapting, getting used to a routine like alternating between cold and hot. That's a contrast shower. It's about going outside in the morning to let your body breathe and doing an intense workout in the fresh air, even if it's already cold. Even if you're freezing, do some muscle work. Muscle contractions also generate a huge amount of heat, so you won't get cold. And this will train your vascular system, making it stronger. Then you won't have any problems with hypertension. Well, that's today's answer from Dr. Golod. I know maybe it's a bit unexpected. Maybe some of you were expecting me to prescribe some pills or turmanium ceramics. Well, friends, I'm sorry if I disappointed anyone, but not everything can be treated with turmanium ceramics, and far from everything can be treated with pills. Believe me, sometimes if your muscles are weak, if you're a bit of a weakling, and you want to have good muscles like Schwarzenegger, you don't need to take pills or lie on turmanium ceramics. You need to go to the pull-up bar and start doing pull-ups. That's how you'll get good muscles. That's all there is to it. A simple philosophy, the simple wisdom of Dr. Golod. It's exactly the same situation with vegetative vascular dystonia and hypotension. No clever devices are going to save you. You just need to take care of yourself. You simply need to move, exercise, build up your muscles, strengthen them. I'm not talking about biceps. I'm talking about the muscular wall of your blood vessels. It's also made of muscle, and it can be trained too. And for that, you just need to train it. Then you won't have problems with blood pressure. So that's today's answer for you from Dr. Golod. Friends, I'm sure that if you have any more questions, feel free to ask and write them. Right now, I'm releasing a lot of videos, both here and in the sponsorship group. That's why the number of videos has increased. Watch them. I'm doing all of this for you. As always, I'm here with you, Vladimir Miroslavovich Golod, neurologist. Thank you for your attention, friends. Goodbye. See you again on Dr. Golod's channel.